Good day, I am Dr. Dulcy. Welcome to the UK Healthhacks. Today we are talking about diabetes. They say 5% of South Africans are diabetic, and the scariest thing about that is 66% of them do not know. So we have people walking around who are diabetic and they just have no idea. I read recently that 200 plus people lose their legs, amputation because of diabetes. And obviously that tells us, we need to educate more and more people about diabetes. So when you consume sugar or carbohydrates, the body or the pancreas, using its beta cells, produces insulin. And that insulin converts the sugar into glucose, which can then be transported to the muscles and the rest of the body and be used as energy. So somebody who is diabetic either does not produce insulin at all or produces very little amount of insulin. You have type 1 diabetes, usually diagnosed in young adults or adolescents. That is where the pancreas is not producing insulin. Then you have type 2, which we normally call the lifestyle related, because that is where your level of sugar or carbohydrate consumption is the one that puts you at risk of developing diabetes. Then you get the gestational diabetes, where pregnant women, especially in the second half of their pregnancy, develop diabetes, but usually after giving birth, they go back to normal. Firstly, you don't want to be part of that 66% that does not know they are diabetic. Please do go see your doctor and check once or twice a year. Prevention is all about lifestyle. We talked about sugar consumption and carbohydrate consumption. You need to limit that a lot. Where do we find sugar and carbohydrates? You have the sugar that you can see with your bare eyes. You get sugar that you put in your tea. There's sugar in sweets, in snacks, in chips and burgers, in Coca-Cola, in all these beverages, in fruit juices as well. Carbohydrates, that would be your pap, your rice, your potatoes, bread, all types of bread have some carbohydrates in them, so you just need to be very selective if you feel you love your bread that much. Physical exercise is very important because then your body is able to use the sugar and the carbohydrates that you consume as energy.